Welcome to the Adapted Physical Education National Standards webinar. This has been developed by Maryland's Adapted Physical Education Consortium. My name is Brad Weiner, and I will be your host for this next hour where we will review the exam. The National Consortium for Physical Education for Individuals with Disabilities created what we know as APENS, the Adapted Physical Education National Standards, and the exam. The procedure for this webinar will be reviewing the 15 national standards. After each standard, we will explore sample questions or two. There are 3 eligibility requirements to sit for the exam. You need a minimum of 12 semester hours, a minimum of 200 documented experience hours, and a valid teaching certificate. The MSDE online course credits in adaptive physical education count towards the 12 credits to sit for the exam. The 3 undergraduate credits in adaptive physical education during your undergraduate program will count towards the 12 credits as well. Visit the APENS website by going to www.apens.org. Complete Part 1 of the application and make a check of $150 payable to APENS. When and if you pass, complete Part 2 of the application. Then mail Part 2 to the address above. Please refer your questions to Dr. Tim Davis. His email is shown on the slide. The exam consists of 100 multiple choice questions. You will have 3 hours to complete the exam. To prepare, it is recommended that you purchase the Adaptive Physical Education National Standards 2nd edition book for $33 and the Adaptive Physical Education National Standards Study Guide for $28. The Adaptive Physical Education Standards book can be found at PE Central. The study guide will be purchased through APENS. The exam will be offered at the Maryland Alliance for Health, Physical Education, Recreation, and Dance Convention, also known as the Mayford Convention, located at the Hunt Valley Inn on October 17, 2014. It will be in the Chase Room on the lower level between the hours of 10 and 1 p.m. We will now go over the 15 National Adaptive Physical Education Standards. Each standard will have sample questions that you will have time to practice your understanding of the content. We are about to start with Standard 1, where we will review the standard. Standard 1 Human Development has a strong emphasis on taking content knowledge and applying it into a classroom practical setting. The standard is divided into the following 7 categories. It is recommended to direct your study to those aspects of human development that influence to a large extent the challenges some individuals with disabilities face in acquiring physical education skills. These range from complexity of games and interactions used in play, the outcomes of engaging in activity with others, and numerous other factors, some beyond the individual's control, that influence successful outcomes. Take this time to read the question and answer the question. The answer is C. The best answer is expressive aphasia because there is no evidence of the attention problem and clearly not a memory problem. Dysgraphia refers to writing disorder, which is not related to the student's inability to verbally express him or herself. Here's another sample question. The best answer is A, the size of the ball, because it is a modification of the equipment. The other answers impact the environment. Prader-Willi syndrome impacts the human growth and development of a child. It is a genetic disorder that causes life-threatening obesity in children. Individuals with the syndrome often have low tone, short stature, and motor development delays with some behavior concerns. We will now explore standard number 2, motor behavior. This refers to how individuals develop. This standard requires the knowledge of typical physical and motor development, as well as understanding the influence of developmental delays on this process. Adapted physical educators should understand motor development, motor learning, and motor control. Here's sample question for standard number 2. Let's take a look at what the answer is. The answer is B. The best answer is varied distance by the instructor. The schema theory suggests variable practice produces the greatest learning and retention of skills. Standard number 3 looks at exercise science. Adaptive physical educators must understand the modifications to the scientific principles of exercise, and application of the principles may be needed when teaching individuals with disabilities to ensure all children benefit from exercise. Here's a sample question for Standard 3. Take a moment to read it through. Do you think you were able to answer correctly? Let's find out. The best answer is D. Students with this disability often have flexion contractures that inhibit full elbow extension. Therefore, activities that involve weight bearing on the hands may be inhibited by elbow flexion contractors. Let's see another question. Do you think you have it? Here's the answer. The answer is B. Hypotonia is a condition of abnormally low muscle tone, the amount of tension or resistance to movement in a muscle, often involving reduced muscle strength. Atrophy is a poor circulation, loss of hormonal support, loss of nerve supply to the organ, disuse of lack of exercise, or disease intrinsic to the tissue itself. Dystrophy is any condition denoting the degeneration of muscles. And dystonia is involuntary muscle contractions that cause slow repetitive movement. Standard number 4 will look at the measurement and evaluation. Understanding the measurement of motor performance to a large extent is based on a good grasp of motor development and the acquisition of motor skills covered in other standards. You should have a good foundation in measurement of motor performance before proceeding with measuring the ability of students with disabilities. Adaptive physical educators must have a knowledge base in measurement and evaluation to comply with the mandates of legislation and how it impacts the IEP process. Let's take a look at one of the sample questions. I'll give you 5 more seconds to think this one through. The correct answer is C. On a bell curve, one standard deviation below the mean places a score at or above 16% of the obtained scores. Thus, it is said to be at the 16th percentile. Standard number 5 is looking at the history and philosophy. Major components of each law that relate to education and physical activity are emphasized in the standard. The standard also highlights a review of history and philosophy as they relate to special and general education. Understanding the knowledge and the terminology related to trends in education is important in the standard. You should know the general intent of the law and specific implications of adapted and general physical education. You should also review educational reform in relation to individuals with disabilities in the U.S. Lastly, you should be able to draw a parallel between special education concepts and adaptive physical education. The first sample question. The answer is A. Posture training was a fundamental concept in medical gymnastics because it focuses on the specific development of body awareness and body control. B, C, and D are not correct because medical gymnastics did not use these as a primary component. Try this sample question out. Do you think you have it? Let's see. The correct answer is A. The least restrictive environment is the place where the student learns best and is appropriate to his or her educational needs. The teacher uses instructional strategies to address behaviors in the appropriate learning environment. The least restrictive environment does not refer to other students. Placement is decided based on the needs by the educational IEP team and is not driven by resources and funding. These sample questions may have you thinking about things that you normally don't think about. Let's look at standard number 6. The unique attributes of learners. Adaptive physical education must have a knowledge base of the 14 federally identified educational disability areas. Unique attributes are important factual information that is utilized while planning and implementing the lesson and the impact on physical activity. Review the disability categories listed in IDEA. Focus on the following unique attributes for each disability and its impact on the areas of motor, cognitive, social, communication, health, medical, and behavior. Let's review a sample question for Standard 6 Unique Attributes of Learners. Let's focus on important words of this question. Hypertonia, traumatic brain injury. Those are going to be key words that we want to focus on when answering the question. The correct answer is D. If someone has hypertonia, which is high muscle tone, they should be involved in slower, more static and relaxing activities. Now let's look at traumatic brain injury. An individual with a traumatic brain injury should also avoid physical activities with high impact and quick jerking motions. This is why A, B, and C are more appropriate activities. We will now explore Standard 7, Curriculum Theory and Development. As you are planning to teach physical education to students with disabilities, you should recognize 5 components to curriculum theory and development. 1. Understanding the foundation of curriculum design, changes in educational trends, and the development of new curricular models in physical education. 2. Selecting content goals based on relevant and appropriate assessment to support goals for the overall curriculum. Structure the scope and sequence of the content. Classify objectives. An analysis of skills and tasks for appropriate progression. Number 3, conducting learning analysis for the IEP process, including determining what assessment to use, conducting the assessment, using the data to make placement recommendations, planning the program activities, and writing goals and objectives for the student's IEP. Number 4, designing learning objectives aligning with the underlying goals of the curriculum. And number 5, planning learning experiences to support the achievement of those objectives. Let's look at a sample question. The best answer is A. The condition under which a particular behavior is going to occur. Whether the ball is pitched or sitting on a tee is one of the fundamental components of a well-written objective. Standard 8 looks at assessment. Assessment in relation to adaptive physical education goes beyond data gathering to include measurements for the purpose of making decisions about special services and program components for individuals with disabilities. Legislative issues. You should have knowledge in federal and state mandates, the referral process, ethical issues of assessment, and the rights of the parents and guardians. Terminology. You should know and have knowledge of the terminology used throughout the screening, assessment, measurement, and evaluation process. This includes formal and informal methods used. You will demonstrate your knowledge for the eligibility criteria, the individualized education program, and the present level of academic achievement and functional performance, formerly known as the present level of performance or PLOP. With administration, this is your ability to conduct the assessment based on the protocols for the tool. Then we look at interpretation, your ability to analyze and use the data results to identify needs, plan future instruction, communicate results to the IEP team, determine eligibility, and recommend service delivery options. Decision making, your ability to drive future instruction using theoretical frameworks, ongoing assessment, results, and available resources. Functioning as a member of an interdisciplinary team. Your ability to function as a member of the educational IEP team includes reporting information to the parents and guardians and other educational team members. The ability to record assessment results for the use by the team, and your understanding for the interface between results with those of other team members. Let's take a moment to review a question related to assessment. If you haven't had experience in conducting a formal assessment, this question may be difficult. Let's review the answer. The answer is C. When the student's scores are converted to percentile ranks, it defines how well the student performed in comparison with the rest of the group on whom the test was normed. Percentile ranks are used to compare students to each other and not to compare students to the test. Try another question for Standard 8. The essential elements of a motor assessment report should include what the student is capable of doing, area of weakness, needs, and recommendation for services. Since legal mandates require that students' IEPs be based on their current level of performance, you need to know what they can do, what they have difficulty doing, in order to recommend physical education program and other services. Standard 9 looks at the instructional design and planning. This occurs prior to providing services to meet legal mandates, educational goals, and the unique needs of the individuals with disabilities. Human development, motor behavior, exercise science, and curriculum theory development are applied to this standard. Planning of the curriculum. You will need to understand the factors needed to develop a systematic overall curriculum plan of instruction and design units and lesson plans to maximize instruction. The IEP and the IEP process, you will demonstrate your knowledge of federal mandates, such as designing and writing a present level of academic achievement and functional performance statement. Annual goals, short-term instructional objectives, and the initiation duration of the services. The technology application, including assistive technology and mobility devices. You will have the knowledge for utilization of communication boards, canes, crutches, walkers, wheelchairs, gait trainers, and other adapted equipment used to enhance the participation of individuals with disabilities in physical education and sports settings. Here's a sample question we can look at for standard number 9. The best answer is D. The key element in the question is standing all day. To do so, muscular endurance is the best answer, as this form of fitness is needed to perform assembly line tasks that require standing for long periods of time. How are we doing thus far? Let's try another question. The answer is C. This is the only answer where the teacher is making allowance to modify the rules and the environment of the game to include the student using the wheelchair. Standard 10 looks at teaching. and teaching practices. The standard encompasses other standard areas such as human development, motor behavior, and exercise science. For teaching styles, you will need a knowledge for the continuum of teaching styles, their strengths and weaknesses, and when to best apply each to a specific situation. Review the works of Muska Malston and Sarah Hashworth to help guide you. Teacher behaviors. You will show your understanding for how the wide range of teaching behaviors are used to promote learning. The 8 teacher behaviors include instructional cues, task analysis, time on task, qualitative and quantitative skill learning, lesson pacing, communicating learner expectations, social climate, and knowledge of results. Review the works of Judith Rink to help guide you. For applied behavior analysis, you will show your understanding how to utilize strategies to manage appropriate and inappropriate behaviors in the classroom by using token awards, communication devices, behavior charts, and positive reinforcement. Are you ready to try a question? Let's see. I'll give you a moment to review this question. So for this question, we're looking at teaching styles. The best answer would be A. Implementing a behavior management plan is the only answer that provides the teacher with strategies to change the student's behavior. Behavior management plans are created by the educational team, and you should not feel pressured to create one on your own. Here's another sample question for standard number 10. When looking at the question, you want to think about routines and your knowledge of the child. The best answer is D. Reducing transitions is the only strategy that is specific to preventive behavior management. In order to reduce transitions, you want to be proactive in your planning for the lesson. Think about each lesson segment and how to move the students from one segment to the next and how long they will be in their segment. We're going to move on to standard number 11, the consultation and staff development. When working with other service providers, it is essential to have knowledge of the dynamics of advocacy groups and basic consulting models. Utilizing active listening and knowledge of administrative hierarchy and program organization are important to addressing the standard. For more in-depth information, you can research Maslow's theories of consultation and staff development online. Take a moment to look at this question. Do you think you have the answer? The best answer is D. It focuses on the problem and provides direction and strategies for solving them. Answers B and C are not in the spirit of group cooperation, and answer A is not part of the stages of consulting. It is important to remember that this is a group effort. Standard 12, Program Evaluation. Components of the standard consist of student outcomes, program operations, and consumer satisfactions. Certified adaptive physical education candidates should be familiar with the Physical Education National Curriculum Standards, published by NASPE in 1995, and the new National Standards, published by Shape America in 2014. The new standards can be found at shapeamerica.org. That is shapeamerica.org. We are now going to take a moment to look at a sample question. Let's look at the answer. The answer is A. When working with the students, it is best to adopt a philosophy that acknowledges and accepts individual differences. B is not inclusive of students with disabilities. The other two choices do not acknowledge diversity, since all students would need to perform at the same level before recognition. Here's another sample question that we can look at. This is an interesting question because it's bringing up the idea of parents. Parents need to be informed of their child's progress in adaptive physical education. What do you think the answer may be? The answer is C. The teacher has the responsibility to assure that parents are kept informed of the child's progress. Choices A and B may make good sense, but are not good practice than a fundamental right under the law. Children are not reliable reporters of their progress as indicated in choice D. Standard 13 is looking at continuing education. The slide lists 5 components of continuing education. Opportunities for professional development are available through coursework at a university, workshops, seminars, and presentations at conventions. Distance learning is also an option. Stay current by reading Palestra, Jopard, Strategies, or other professional journals. Remember, try to stay current with technology advances in the field. Being part of this webinar is a good way to continue your education. Here's a sample question for Standard 13. Take a moment to read through it. This can be a difficult question related to the State Department of Education and how it pertains to adaptive physical education services. Who is the key person to contact? The best answer is D. The Director of Special Education should be able to provide assistance. The other answers, A, B, and C, may not be the best depending on your state. Many states no longer have a state supervisor for health and physical education. The state superintendent and their immediate staff may not know about adaptive physical education and would only direct you to other staff. Are you ready for another sample question? The answer